Yeah, sure. Whenever you are ready. And we are all online, we can start.
Yeah, I think we can start now.
Okay, then. So, I would like to present, as I said, my experience the last at least 5 years with the use of the 3D curly policies, how I'm calling it, and the way that I'm using it, and also the benefits of the devices from classes that I'm happy to have fat reduction. And as we all know, there is an endless quest for beauty that is always continuing, although the ideals are adjusting according to every era. But there is the aesthetic principles that we need to respect. And of course, there are comparisons and the efforts are unavoidable. As a plastic surgeon, I can perform, of course, the body contouring surgery that can help. And you can see here patients that are representative of cases that need to be treated using surgical procedures. However, there is a universal trend for non-invasive procedures as well, and that goes for the body contouring as well. And we cannot dismiss that. We need to hear our patients and their preferences as well, and we need to strive and try to achieve whatever we can to satisfy their wishes. Of course, there are the statistics that are supporting what I'm saying. There are the latest ASPS statistics for procedures for last year from the American Society of Plastic Surgery in America. And it shows that there is an increase of up to 48% for non-surgical cellulite treatments as well as non-invasive fat reduction, and especially with the technology that freezes the fat away. It's 6% up last year and has a stable yearly increase. That goes a little bit less for the injection lipolysis that we all know, the deoxycholic acid that is also useful, but in my opinion, that will show later, it's more beneficial the use of the curl policies. The same goes from the statistics we have from the American Society of Dermatologic Surgery from last year that also shows that there is 80%, 84 actually percent in interest for patients that want to get rid of excess weight in any part of their body, and 73 from under their chin. We'll get back to that later on in my presentation because it's very, very interesting. Now, the 3D cryo policies, 3D cryo scalping is a non-invasive procedure that uses the 360-degree cooling technology. Result localized fat reduction with a special patented design from classes. It can induce apoptosis only in fat cells symmetrically, and it can offer a very nicely smoothed out result, preserving all the other tissues except of the fat cells. And here it's a representation of the way that it is acting. And it shows that it has a more unified kind of effect in every, in the three-dimensional way in the area that is applied compared to other technologies. Here you can see the different treatment areas that we can improve, starting from downwards. It's the double chin and the lateral leg, the outer arms, the abdomen, of course, the flanks, even the pubis, I'll show you later, outer thighs, inner thighs, anterior thighs, the knees, the legs, the lower legs as well, and in the back rolls, the flanks, the buttocks, the banana rolls, posterior thighs, and the knees again from the area, from the back side. So there are multiple areas that we can apply the 3D cryolipolysis with a 360 degrees handpiece that can cool down up to -9 degrees Celsius, and it has a very strong suction. I can induce permanent apoptosis of the fat cells non-invasively. It has minimal consumables, which is quite important. Working in private practice, we need to consider the cost as well for us and for the patients. And simultaneously, you can apply two different shaped applicators. And finally, what is quite important is that it doesn't cause skin sagginess, but according to my experience, but in general too, and the patient's opinion, it can cause skin tightening, and we'll see that later on. So here, I would like to show you the difference between the 360 cooling effect that can cause the 3D result that we are looking for compared to the flat plated handpieces that they are in general in the majority, I think all the other devices that can cause only limited effect because the cooling effect is just between this area and not the whole area of the area that we want to treat, the whole in 3 dimensions. So that means that you can have a much far better and quicker as well result. There are different other methods non-invasively that can cause fat reduction, local fat reduction, and there is in this comparison of the other ones, I think if you see there are the high density focused ultrasound, the unipolar radiofrequency, low level laser therapy, and the one that I mentioned before, the injection lipolysis with deoxycholic acid injection. However, if you see the different mechanism of action and the pain level and the side effects and the treatments needed, eventually, I think that 3D cryolipolysis has the best characteristics because it has a low pain level, numbness for a few days only, that's virtually nothing, or some bruising, and it can have a good result in 1 to 2 sessions. And as I said, probably there are some bonus effects, the skin tightening that I've seen it for sure, but as well as some change in the metabolic rate that can help patients to lose weight faster following that. And also we can see, we can apply that in difficult areas of the body that we cannot do other things and avoid surgery. Here there is a small video of the way that I like to do the marking and the measurement and the procedure later on. I'm using an electronic device to measure the fat in this area that I'm planning to treat, and I'm very careful to have very recorded always the numbers that are the fat that is included and the same areas that I need to go back. Here I'm testing to see which is the appropriate handpiece, and then I do my marking also always in a standing position, and then we do the cover up of the skin with a special pad and the application of the hand pieces that stays for an hour. In the maximum, always I put the maximum cooling and the maximum sucking effect. After that, it has 3 minutes of massage, and here you see the patient after the end of the procedure. And it has a small redness, but you can see the improvement 2 months later of the inner thighs area that was treated. I have done multiple studies for 3D cryolipolysis, and this is one of them. And it was a prospective study of 502 patients that they had 1 to 3 sessions of 3D cryolipolysis on the same area, a mean age of 45 years old, and the mean BMI was 24, and they were different areas that were treated. Some of them, the majority had one area treated, but a lot of them had other areas treated as well, and 74 had more than 3 areas, and the majority were, of course, the flanks, that's the most popular area, lateral thighs, and the abdomen, of course, central abdomen especially. But you can see that it was applied in other areas like the arms, the back rolls, banana rolls, etc. There are many, many, as I said, areas of the body that can be treated using the 3D cryolipolysis. So what I showed in the video before, I do the measurements always before and after the conclusion of the treatment, which is 2.5 months to 3, using a skin fold caliper. And it's electronic, and it helps me a lot to record very easily what is there before and what is there after and what is the response. And that's how we estimate and we appreciate the response and the results for every patient and for every area. So the patients in this study had to complete a survey. It's according to Guy's 5-point scale. And of course, there were 2 blinded plastic surgeon photographs evaluation to confirm our results, and they were blinded for that reasons. The Gallmer measurements showed a significant reduction of the areas 15 to 38%, which is a very considerable response. And of course, the patients, 80% of the patients marked the results as very much improved. They were quite happy. This is a very high result, good result, positive result. And they didn't think anyone thought that it was not a good one. Plastic surgeon photograph assessment showed 69% very much improved or much improved of the results, 22 improved and 9% only no change. So what about the side effects? As we know, it's a very good tolerating procedure, and 75% of the cases had only mild edema, bruises or numbness that all resolved in a few days. And in my series, that is considerably high because I have more than 3,500 sessions by now, even more now. I haven't had any of these paradoxical adipose hyperplasia recorded in any of the patients that were checked following the procedure. I'm happy and honored to have presented my experience and our experience as a team in the IMCAS multiple times already, and as well in different meetings abroad. Last year it was in America, in Chicago, in Miami. This year coronavirus prevent us, but hopefully next year we're happy to do it electronically at least. And I'm happy to announce that the book that I was invited to have a chapter entitled 3D Cryolipolysis for Body Contouring. And the book is coming out very soon from the very well-known Theme publishers in America by the title Emerging Technologies in Face and Body Contouring. If you are interested, it would be a very good book to have in your library. So there is a question, maybe philosophical one, but I always want to pose to myself questions and try and help me to go forward. If there is any comparison to surgical and non-surgical procedures, and 3D cryolipolysis can be compared with a liposuction or with abdominoplasty, and honestly, I think that proper patient selection and technique with the correct use of effective equipment can often lead to some comparable to surgical results, and I will show you why. I'll show you a few cases that are surgical. Okay, they're patients of mine. We've done liposuction, left counts, back rows, and you can see the after results. So this is the before and this is the after. But what about this? This is a 3D cryolipolysis in flanks and back rows in a patient of mine. And being a surgeon, I think, and I've asked other colleagues of mine, surgeons, that they were quite happy to see a result like that in an hour with no recovery. And this patient that had a surgical liposuction in the outer and inner thighs with the recovery that involves, that is not to be dismissed, can be compared with this. This is the patient that I showed in my presentation of the video. Had a 3D cryolipolysis in inner thighs and has a very nice result that can be deceived for surgical results, I can tell. Another result, inner thighs as well, and that's a surgical result, again, liposuction. But what about this? This is 3D cryolipolysis, has a very, very good response. And mind you, these patients didn't lose any weight because they were including in my study, and we had this requirement for the patients not to lose weight unless maybe 1 or 2 kilos to maintain their weight. So this is because of the treatment. Here again, the patient, the before patient. And here I'll show you a few results from upper flanks and below in this patient, an unusual upper abdomen in this one that she was only bothered by that and then finished. An operated abdomen that is very, it's not an easy case to do, even surgically. And of course, we checked here before with the ultrasound to make sure there is no hernia, because this is something you need to check before a cryolipolysis in the abdomen, especially if there is a surgery before performed. And she had a very good result. In every patient, we need to check the skin and how the fat is, if it's soft or if it's dense, because it can make a difference in the response, and they need to know about that. Here is a patient that has tria, as you can see, and has a lipo in her abdomen after pregnancy, a lot of fat and sagging abdomen. So she's a good candidate for surgery, but she didn't want. The majority of the patients don't want to go under the knife, so we have to have a good solution for them, and that's a good solution because, as you can see here in the frontal view and in the lateral view, the patient had the sagginess is not showing anymore. So that's how I'm supporting my opinion of skin tightening following the 3D cryolipolysis. And of course, men can benefit from that. They have this usual accumulation of fat around the abdomen and the love handles, and they can respond really well, as you can see. Another man in the flanks area. And that's a case with a lady who was a good candidate for surgery as well, didn't want, of course, and she decided to take my help and try to lose weight. She lost only 7 kilos, but we had multiple sessions in different areas, and you can see 8 months later how her body has been transformed. That's why I said that I think there might be, I can't prove it yet, a metabolic rate increase and helps the patient when they start doing the cryolipolysis to lose weight as well more easily than without it. And you can see the lateral view, it's quite impressive. This result with this patient who's done nothing else than multiple sessions of 3D cryolipolysis in different areas of your body. There are difficult areas as well and unusual that can be done, like the back rolls, like in this patient that it was combined the flanks and the below area. Here also, an older patient, she's like 65 years old. It can be done in older patients as well, that are not easy to go in surgery and can benefit too easily, like this one. Didn't lose weight, she just improved. That patient too, same areas, usual areas. What about the men with gynecomastia? This is a difficult and embarrassing problem for men. And so far, the only solution was surgery. But I think the 3D cryolipolysis can help and can help significantly. And if you do more than one session, in this patient, it was only one session. He came back and we did more, but I wanted to show you the result after only one session. We can see here the nipples, that is the most sensitive area, that were pre-treated with the xylocaine cream in order to do the treatment because it's more painful, but you can see the improvement. I think it's quite impressive, and the patients agree to that. I can show you a few more results from gynecomastia in patients that has a good improvement, and you're happy with that and didn't need to do anything further. Another area which is unusual is the axilla area. Sometimes there is fat accumulation there, right next to breast and right next to back rolls. And this can be treated with the application, the correct application of 3D cryolipolysis. The buffalo hump, unusual, but can be treated with that method, no surgery, no injections. And the back rolls quite usual. And you can see in this patient, except of the improvement of the fat is less, but also the sagginess of the skin, you can see, is less too. So that's why I'm saying there is clinically obvious skin tightening effect. Here is a misfortunate lady that had a bad surgical result following abdominoplasty from a non-plastic surgeon. And of course, she didn't want to hear about going back into the operating theater. And she only wanted to get rid of this inflated pubis, to say, in a way that is, in a manner that is not offensive. And after only one session, it's obvious that this area is much less, prominent. And she was really happy to the degree that she didn't want to do anything else. What about the arms? Arms is an area that ladies we are very bothered, and going older even more. It helps on the sagginess, because always there is saggy skin, and you can see it can become straighter. You can apply it right there. I'll show you a few more examples. from the help that can offer this procedure, and can be applied. The flat handpiece can be applied here and can make that looking straight after 2.5 or 3 months time, with and improving the saggy looking of the arm, as you can see in these patients. The knees is another concern, and you can see how it can be quite well responsive. Here is a patient with sagginess and cellulitis that I didn't even dare to take her to the operating theater because I was afraid it could make it worse, the sagginess. So she's one of my first patients that I treated with the cryolipolysis 3D. And we did the treatment here in the below love handles area, here in the outer thighs, the inner thighs, and the knees. And as you can see, it becomes straighter and not more sagginess. The tightening of the skin is obvious and the straightening of the skin, and she was very happy, and I was very happy too. That lady needed to go to surgery. She's young, like 30 years old. She didn't want. She agreed to have multiple sessions, which I did. Inner thighs, knees, lateral thighs, buttocks, banana rolls. You can see all the areas treated, because here you can see her 2 months later. But 2 sessions in each of these areas, because this is quite an intensive problem she had. But now she's a happy patient, and she didn't go under the knife either. So she's thanking me in double. What about that patient? That legs. When I first saw, I was not happy. The lady's carrying that for, she's like 45 years old. She never wore a dress that is show off her lower legs, and she was very discouraged to get in surgery, because even surgically this is not easy to get. So what we did is we applied 3D cryolipolysis in 4 different areas, as you can see, inner and outer areas of the below knees area and around the ankles. And you can see her improvement. She's very, very happy now. And you need to do it really carefully and well designed, the areas that all there is a prominent fat, and it can be applied the flat handpiece. Now with the CLATUU Alpha, you can have more. This is done with the previous device, but with the CLATUU Alpha, we have much more options of shape for the handpieces that can be applied. The anterior thighs is an area that is bothering a lot of patients, and it can be improved. You can see here the difference. We applied it here, and she's not as well. She had a hip replacement, and you can see. But she managed to have a result without consent of patients and doctors. And I can tell from patients that I've done all these years that it can cause skin tightening for sure. In this patient that she didn't have much of fat, but sagginess, you can see the skin, how much it's improved. We did it 1 session in this photo that you see, but I've done one more to her just for the skin tightening that it can offer. This patient I showed you before, it's quite remarkable, the tightening. And that patient that I just saw, of course, gynecomastia has sagginess as well that it can be treated. And the arms get straight. Here on this patient, she had so minimal fat accumulation. However, the sagginess was something that was bothering her, and now became straight. You see, So this is skin tightening. We need to prove scientifically how this is achieved, but surgically, clinically it can be done. Now, another area that is main concern the latest years, as we can see from the statistics of the American Dermatologic Society, is the chin, the double chin, and the neck, which has fat accumulation, and it can be caused by different factors, including age and diet, but mostly genetics is important. And it's affecting the face contour and the neck definition. It's a sign of aging, and weight cannot be hidden. 73% of patients are bothered by that. Now, with the CLATUU Alpha, this device has these multiple hand pieces with different shapes, and that's very helpful because you can treat the patient, the double chin with this round one, and the natural neck with this straight one. Also, the device has an upgraded 360 degrees surrounding cooling that it can even increase its efficiency 18% by 18%, and the suction is stronger, so it gets to the temperature much faster, the target temperature, than previous models and other devices, always keeping the 3D effect, which is very important for the better and superior result. What we did a study for the submetal and lateral neck fat deposit, as well as the skin sagginess, and we are honored to have our study recently published in the Ideas and Innovation section of Plastic and Reconstructive Surgery Global Open Online Journal, which is quite a prestigious one to be in. If you would like to read this article, I'm sure you will find it very interesting. And we have included 34 patients following one session of 3D policies on double chin and lateral neck areas. And their mean age was 50 years old, BMI was 26, and they had, of course, again, a stable weight maintenance during the study. Again, we had the same method of measurement with the skin fold caliper and the surveys and the blinded photographs evaluation. And the reduction was very significant, 20 to 50% in some cases. And it was confirmed by the analysis we did with the pairwise comparisons, and the p-value was less than 0.001, so that's very significant, important. And the patients, of course, were very happy. 82% of the patients thought that the results were exceptional. And the question this time was if they thought there was a skin tightening. That was for the patients and for the plastic surgeons, the blinded plastic surgeons as well, because to me it was obvious that there was a skin tightening, and they agreed. 68% thought it was, and the results from 76 of the patients were, for the plastic surgeons, were very improved. And again, the adverse effects were minimal. They're very mild pain maybe in the beginning, but a little bit of numbers or mild edema, they're all resolved very quickly. And compared to injection lipolysis, which is the main area that is administered, I think it's far better to have the 3D cryolipolysis because there is almost none of recovery. And there is only one session. As we all know, injection lipolysis needs more than 3 to 4 sessions. A few examples, and you can see the measurements of the skin fold that we take in baseline measurements and after the treatment, 2.5 months, and you can see the diminished of the measurements. And of course, you can see clinically how the patients are improved. That patient, we did the double chin and the lateral neck area right here, and she was very much improved as well. Another patient that has more of skin sagginess, less and not so much fat, was improved the skin sagginess mostly, and the same goes for that one. So that's what I said about the skin tightening effect. There is not much fat in some patients, but mostly there is skin sagginess, and it can help significantly for this from obtuse to become sharp. That patient as well, you can see the improvement. Only in one session of the 3D cryolipolysis. Lateral neck is improved, and you can see the contour of the face is getting better. Here is another patient. You can see how you can see the contour of the mandible and the whole neck. Here is a very impressive response from a patient, except of the numbers is very obvious on the numbers and clinically. This is a patient that had a very prominent double chin. Actually, he had two areas that I had to apply the hand pieces, sorry, one here and one here in one session, in order to get all these extensive double chin, as well as in the lateral neck. This was done in 2 hours, because we can apply 2 hand pieces in 1 hour. So we applied one hand piece here, one hand piece there, 1 hour, and the lateral area too, another hour, and you can see his response in 2.5 months. Now, I tried the area of the jowls in this patient, because jowls is a ptotic area that can accumulate a small fat deposit, but it's very obvious in some patients. And I thought, when it's so measured, we can probably treat it. So we did a session to this patient, and you can see her response that is quite obvious in these photos. You can see the right jowl that is diminished and it seems much more straightened up, and the left jowl, and that goes also for the skin tightening. Finally, I have been using the combination of 2 devices that I have, unfortunately, have in my clinic in order to treat patients that need more extensive application of the 3D cryolipolysis, but don't want to spend time, and they want to finish in just an hour. So that's what we do. We combine. Here you see the marking. It's an extensive abdomen in this patient, and that's how I like to call it. It's the 3D cryosculpting now. And we have initiated a new study for multiple areas application of 3D cryolipolysis. I'm going to show you a few indicative cases that is a combination of application of the hand pieces. Like in this patient, she had the lower abdomen treated and the love handles in 1 session. And you can see her improvement for all torso. Her torso is thinned out in just 1 hour with no recovery. We applied in her abdomen simultaneously the handpieces and her love handles, and that's her result in the back and the previous one in her abdomen. Another case, she has more problem on her legs. You can see the application, inner thighs, inner knees in this patient, and here the lower love handles and the anterior thighs, and here the outer thighs in 2 areas because she had an extensive problem there from previous surgery she had, and you can see the improvement of her upper legs and her outer thighs that they were scarred before. That's a very big abdomen. So you cannot treat her in one session unless you can put the 4 hand pieces like in this case that we applied the hand pieces upper here and lower here, and you can obviously see her improvement in 2.5 months. We need to get back and do some more on her, of course, and keep always in mind that this patient, in order to get in the studies that I'm doing, they have to maintain their weight in 1 or 2 kilos only. So this is only by the effect of the 3D cryolipolysis. So here another case, in inner outer thighs, this patient also had residual fat from previous surgery. So in 1 hour only, we applied 4 hand pieces on this patient, and we did the 3D cryoscouting, and she was very happy. Another one, she needed more areas. So in this case, we had like a full body 3D cryoscouting. We had to have 2 2-hour sessions because we did upper anterior thighs, lower knees in one case here. Next, the knees above area and inner knees. Here, it's the lower anterior thighs and her arms. And here is the back where we did the banana rolls and her back rolls. And here you can see her improvement. I think it's obvious that it's improved, and in 2 hours, 2 sessions, done. Another one, also she had a need for lower body sculpting, so we did her outer thighs, inner knees in that case, and inner thighs, gluteal area again in that case. And case 6, 3D cross sculpting again, lower body sculpting again. Here we have patients that they need that. We are in the Mediterranean, and a lot of females have this kind of type of body. So in her case, we did inner knees, inner thighs, outer thighs here, and the gluteal area that you can see here. The improvement of the gluteal area without surgery is very happy. Another one, she had multiple areas as well. Inner thighs, abdomen, upper and lower, gluteal area, because she had a quite obvious gluteal area, you see. Outer thighs, lower here. And her improvement from here to here in every area that we treated is quite obvious again, and the patient is happy. Inner knees, anterior thighs in 1 hour again. She's ready to go to the beach without any other intervention. So, in concluding, I think 3D cryolipolysis and the use with the CLATUU Alpha device is quite safe, quite effective, of course non-invasive, with no recovery, and it can have some extra bonus effect with this, the skin tightening. I thank you, and I wish you to enjoy the rest of your summer. safely, and I'm happy to be joining you. And if you wish to have some questions, I'll be happy to answer. Thank you so much.
Okay, thank you for your presentation, Dr. Billy, with significant clinical results. And thank you so much, Dr. Billy. And now we have question and answer session. So if you have any questions, please tap chat at the bottom of the list on the left side of Zoom meeting and type your questions. And Dr. Billy will tell you and give you an answer. Any questions, everyone? That is a question from Vera Agrani. She sent me this message. So, Dr. Billy, can you see the questions? Mm-hmm.
What is the time interval between Lee and Palmer? Is that correct?
So the question,
the interval between two sessions on the same area, what cup applicator to use for the inner thigh area? What level of suction and cooling level do you recommend? Usually the cup applicator for the inner thighs is the flat one. It is not easy to apply a bigger one, curved, because of the area. It's not easy to handle. I always use the maximum cooling and suction unless the patient is not comfortable in the beginning. If the patient is not comfortable in the beginning, like in certain areas that are more sensitive, like the knees, it's very sensitive, the inner thigh sometimes, the arms. In this case, I start with the lower half suction. And then I go gradually. After the beginning, the first 4 or 5 minutes, they get numbish. So at that point, I go to the highest cooling, the highest suction. I always do that, and I have all my studies are done with the highest cooling and the highest suction. How do you put the fucking butter? What cup, Mrs. I don't know, Daniel Dewey, what cup applicator for buffalo hump and what level suction and cooling level to use? The buffalo hump is a dense fat area. So I think the small curved cup applicator would be the appropriate, and of course in the highest cooling and suction. The last εγώ δεν μπορώ να τα βλέπω. Γιατί δεν μπορώ να τα βλέπω. How do you put the hand pieces for the CLATUU reduction for the periodic precession? Okay. What do you put, Mr. Mrs. Chien Mien Lee? How do you put the hand pieces for the double chin reduction? Total 3 areas per session. Usually I use there are 2 hand pieces, small hand pieces for the CLATUU Alpha. One is curved and the other one is flat. The curved one I'm using in the middle, in the double chin here, the curved. The flat I'm using here on the lateral neck area, and I try to stabilize it, and the patient has to be stable because easily they can sometimes get out and the suction is not the highest. It has to be the highest. The total 3 areas per session, not for the neck area because I have 2 hand pieces for this area, one curved, one straight. So in one session with CLATUU Alpha I do usually I do the double chin and one side, and maybe if needed I do the other side of the neck, the lateral neck. You can read this article that is published in PRS Global, and you can see the information there. Mrs. Elena Gusarova, what are contraindications for this treatment? Not many, basically very little, unless if someone is allergic to cold. Cannot do that, but I haven't seen. And in some cases that they have some autoimmune diseases. I take the opinion of the doctor that is under their care to confirm, but so far I have done many patients with autoimmune diseases and they were fine. I don't think there are much of contraindications that you should be afraid of. Follow-up pictures after 3 treatments. I don't think I understand exactly. The follow-up pictures that I have usually, I'm showing follow-up pictures after 1 session, and the majority, I think most of what I've shown you today is after only 1 session. Of course, if you do more sessions, you get a better result. Any solution for the pain at the treated area after removal of cap after completing the treatment? Okay. Yeah, this is an issue sometimes. In patients that they are sensitive beforehand, I give them paracetamol 1 gram. But in general, this happens after the massage. The 3 minutes massage that is a requirement, as it is proven, gives a better result. There are a few cases, very few cases, that the patients couldn't tolerate it afterwards because there is the revascularization of the area and sometimes it's painful. But if you support the patient, you let her lie down during that 5-10 minutes time, it's fine. It doesn't last longer. Sometimes they have bruises that they are painful, but not at that time. later on. So I give them to take some arnica cream that is helpful for the bruises. Have you ever found, Vera Grimy, have you ever found subcutaneous induration and PAH cases? If yes, how to handle it? As I said, I never found paradoxical adipose hyperplasia following 3D cryolysis. I don't know if it has to do with the technology behind it, but I haven't had. And the same goes for the subcutaneous induration. I haven't had a report for something like that. They have bruises that takes time to get better, but in duration, I don't think. They're sensitive for some time. Usually not sensitive, they are numb. And I warn them that they will be numb. And that goes. Can this be used for breast reduction? I never used for that. I haven't used for that yet. I don't think. I have used it only for gynecomastia. But it may be an idea. I'll consider it, but I don't think it's a good option. I don't know. I haven't used it.
Okay, thanks,
Are
Phyllis.
there
Yeah.
Yes?
Yeah, and anything else you can tell?
Is there another question?
Yeah, there's some more questions you can see.
Okay. Let me see.
Mhm.
Cecile, when you compare results CLATUU Alpha and 360, what would you say? Is there a big difference with them? CLATUU Alpha and 360? Which one is the 360? I'm not sure I understand the question.
That's a CLATUU. It's 360.
The previous model, you mean?
Yeah.
Yes, they're comparable. I think CLATUU Alpha is better. I think though, it's better because it has a bigger suction and freezing effect. And of course, you have much more choices of handpieces, which is very handy. And it gives you flexibility, and you can do very many things with that easily. Vera Griani, I once got my patient hyperpigmentation after treatment. What caused this to happen? Hyperpigmentation. The patches were used properly. Was there I'm thinking of reasons. I didn't have it. Only following liposuction I had that, but that was because it was very big bruising to the patient that took long to wear off. Sometimes it can be that, but it goes. Another reason, if the skin is too dark or you're close to the genitalia area, which is darker, can be caused that. Otherwise, I haven't had that. How do we get the skin tightening with CLATUU, and when do you recommend to do the second section for the same area? How do we get? As I said, I think the skin tightening is a bonus effect of the treatment. When it was made, the CLATUU, or the device is the CLATUU Alpha, I didn't think the constructor was intending to make a machine that can cause skin tightening, but I see it does cause. And that's a bonus effect, and it does it in areas that have saggy skin, usually like the arms, like the double chin, the inner thighs. I showed you different areas of the body that has had that effect. I'm not sure about the mechanism, the scientific reasoning of that. I'm not sure. But there are a few ideas I have because it's so gradual, or because of the mechanical effect that causing the fibroblasts during the time of the cryolipolysis because of the suction. I'm not sure what is the reason that is causing it, but the result is beneficial and it's causing it. So we get advantage of that. And the second session, for the same area as I said, I do it usually 2.5 months to 3 following. What is home care advice? Plenty of water and massage treated area. Home care advice is, of course, yes, the water. I don't recommend them to massage the treated area unless we do it when we finish for 3 minutes. It's proved that this is scientifically proved that it's beneficial. I haven't tried to tell them to massage at home. What I give them is the recommendation of some arnica cream in case they have bruising, and to get back to their normal activities, and to do exercise, and basically that's it. Does it also tone the muscles? I'm not sure. I don't think so. I don't think it can go. Its effect is purely to the fat cells and the fat layer that is just below the skin. I don't think it can go. It can affect so deep down below the fat. I can see it can affect the skin and cause tightening, and of course the fat to diminish it, but I don't think it can affect the skin, the muscles. Which technology do you think is the best to combine with CLATUU? RF, acoustic wave therapy, and acoustic wave therapy. And when can we start doing this treatment after CLATUU session? RF is a very good option, yes. Also, we do in some patients that they have very dense fat in their lateral thighs, usually that's where it is. We do endermology. We do this massage like 3-4 sessions before I do the 3D cryolipolysis, because it helps the fat to become a bit more soft. So the effect is better, because I have noticed that the best response is on the areas that the fat is not dense, is softer. It's more easily responding. I don't have experience with the acoustic wave therapy. I do have a vast experience with radio frequency, and I recommend it, and they can start doing it. I think a couple of weeks after the 3D cryolipolysis. As soon as the irritation, if there is any, of the skin goes, they can do the RF. My favorite is the body tight technology, which is quite popular right now in America, and it has invasive and non-invasive handpieces that are quite effective. For example, Morpheus, which is non-invasive, is very good. I recommend it.
Thank you for your answers, Dr. Billy. And is there any further question or clinical inquiry? Anyone? Anything else? Yeah, I really appreciate your presentation and your in-depth knowledge and experience. And thank you for your time and effort to attend this meeting for everyone. And thank you
Say
so
it
much.
again.
Thank
I
you.
didn't hear the, can you say, I didn't hear your last sentence?
Yeah, thank you for your time and effort to attend this meeting. It's very honored and pleasure.
Oh,
That's what I'm
thank you for
saying.
having me.
Yeah.
I believe it was helpful for everybody.
Yeah, I look forward to seeing you again in another classes webinar seminar soon. Thank you.
Sure. Looking forward. Thank you. All the best.
All the best. Thank you.
Thank you.